Hey, what's up, Boobdoc fans? This is Dr. Z back again, finally, with a new video. It's been a while since I've been here on YouTube. I've been doing a lot of other stuff, working on several projects, but I'm back with a new video. Today we're talking about South Korea, the self-proclaimed center of the world for plastic surgery. Is it true? What's going on in South Korea? Plus, there's an important story and a new law in South Korea regarding cameras in the operating room. Stay tuned to check it out. Here we go. Today I want to talk about this topic of being recorded in the operating room. What do I think about it as a plastic surgeon? What do you guys think about it as surgeons, physicians, or more importantly, patients or prospective patients? But before we get to that, let's take a look at plastic surgery in South Korea. Now, the South Koreans are self-proclaimed leaders in plastic surgery. They say there are more cosmetic surgeries performed per capita in their country than anywhere else in the world, as well as more plastic surgeons qualified to do these procedures in their country than anywhere else. And there's lots of sites promoting tourism for plastic surgery in this country. And without a doubt, there's lots of good stuff going on there. There are plenty of qualified plastic surgeons in South Korea doing good work. And I'm sure there's plenty who are not. But are they the leaders in plastic surgery? Are they the cutting edge for cosmetic procedures in this world? I'm not so sure. Let's take a look at some of the stuff you can find online. All right, so let's see. Here we've got some South Koreans prepare for post-pandemic days with a facelift. And this is just an article from the Washington Post about this resurgence in plastic surgery in South Korea after the pandemic. And in fact, this is something that I talked about in a recent video I uploaded to my Zannis Plastic Surgery channel that was an interview by the local news media. In fact, this is true. We are seeing a boom in plastic surgery procedures during and throughout the peaks of the pandemic, as well as what looks like afterwards. And for several reasons. We call it the mask phenomenon, etc. I'm not going to get into all of that stuff. There's lots of reasons. Zoom is a big part of it. American plastic surgeons say business is up partly because people don't like their images on Zoom. That's true. That's exactly what I talked about. People coming in with extra time off of work and an opportunity to do plastic surgery, as well as some extra money in their pockets sometimes, depending on the financial situation. But with these grants and the government paychecks, there's a lot going on there. But anyways, this is true. This is something that we saw. There's another website called Soul Guide Medical, which I think is interesting. This is just a medical tourism site produced by Seoul, South Korea, talking about their strength in plastic surgery. 500,000 is the number of expected medical tourism patients in 2018. So this is a couple of years old, this statistic. But they're all focusing on cosmetic surgery. Here they are, the plastic surgery capital of the world. So it's got the most plastic surgery cases per capita, like I said in the opening, and it's a normal part of their culture, so it's very accepted. It's something that is not taboo, and of course in most of the developed world is no longer something that's considered taboo, but a very normal part of our culture. Korea is known worldwide as the leader in skincare, all right, high-tech dentistry. Korea is not the cheapest place for medical procedures, but it is the outright best. It is also not the most expensive. You will find reasonable prices for the best doctors and surgeons. There is no other place on earth where you get the highest level of medical care at such a reasonable value. Are they talking about Zannis Plastic Surgery? No, they are talking about South Korea. Okay. Your trip to Korea will be more than just for a medical procedure. Korea has thousands of years of culture, so it'll be fun. You can have some Korean barbecue. All right, so these are the claims that they're making, and then this is an interesting article just from a little insider magazine. Business Insider is not the most reliable source, but what they're talking about is that the beauty standards in a lot of the Asian countries are not the same as the ones in Western countries. And of course, that's true. Every culture has their own beauty standards. Some of them are universal, but others are most probably not. And what they're particularly talking about is skin whitening, nose jobs, double eyelid surgery. All these are things that are very popular. And if you look here on my screen, in South Korea and other Asian countries, definitely in Japan, we hear about this. The double eyelid surgery is creating this extra fold here so that you have double eyelid instead of this one large eyelid with an epicanthal fold. Some people call it westernizing the eye or creating an occidental eye. Whitening and bleaching of the skin is hugely popular. And then nose surgery is putting in a dorsal implant or creating a more Western nose. A lot of critics have said that Asians are trying to Westernize their appearance and to grasp our beauty aesthetic is not necessarily what they are trying to do, according to this article. This talks about a long-lasting Korean desire to have double eyelids or to have a more prominent nose, regardless of the prevalence of these traits in Western countries. So the misconception is that Koreans just want to look white. This article says the misconception that Koreans just want to look white is a symptom of Western arrogance and Eurocentrism that has no basis in reality. Pale skin has always been a standard of beauty, not only in East Asia but all of Asia, based on the implications of that lighter skin means you are less in the sun and less working outdoors, true, and there's the caste system in India and all that is true. Further, the type of nose bridge that Koreans tend to ask for in a rhinoplasty is markedly different from the ideal Caucasian nose bridge, and the crease above the eyelid has always been sought after in Asian cultures, both because it is rare and because it creates visually larger eyes. So they're saying, you know, these traits, they may resemble Western traits, but it's not because we want to look like Westerners. It's because these traits have always been a high beauty standard in our culture. So, you know, either way, it doesn't matter. It's something to think about. All right, so what really sparked my interest in South Korea is this story that came out about a week ago. In South Korea, lawmakers recently passed a new law requiring cameras, closed-circuit television cameras, to be in place in all operating rooms throughout the country. Not just plastic surgery operating rooms, all operating rooms. And this law, although controversial, was passed by lawmakers with some plastic surgeon support as well as a lot of public support. This scenario of having cameras in the operating room has been brewing for some time in South Korea, and what really spurred the push for having them in all OR theaters, what really intensified this call was after a case in 2016. There was a university student, I believe he was a junior, by the name of Kwon D-hee. He underwent some jaw reshaping, something he'd been wanting his whole life, to feel more confident about the shape of his jaw. And it actually was more of a slimming procedure, whereas you would think in our country, a more robust jawline, a larger chin. These are the sort of enhancements that males usually seek for jaw reshaping. This was actually more of a slimming and refining procedure, which according to the aesthetic preferences in South Korea is more attractive. At any rate, he underwent this procedure. During the surgery, the patient lost almost 3 liters of blood, according to the reports. He ended up going to the ICU afterwards in a coma, and shortly thereafter did pass away. And what happened was the patient's mom, who was obviously distraught, obtained footage, CCTV footage of her son's surgery. There happened to be a camera in that operating room, and she retrieved that footage. And after rewatching the video hundreds of times, carefully investigating it like a detective, she discovered the evidence that part of her surgery was performed by others, not just by the surgeon. She said that there were nurses or assistants performing aspects of the procedure, not just assisting, that was likely cause for some malpractice. She was in fact awarded a victory in court, but this case, along with others where it was shown that non-plastic surgeons are performing plastic surgery, or even non-physicians are performing parts of surgery in the operating room throughout South Korea, and I'm sure many other countries, led to this call for reform. They didn't want to have ghost surgeons performing the surgery, people unqualified. And so the law came in about a week ago that there is a requirement for cameras in the operating room recording at all times. So in case of a problem, it can be reviewed. And if there is not an active camera in the operating room, there is a potential for jail time, up to 5 years in prison, or at least a $40,000 fine. So what you can actually see here in this video is the surgeon walked into the room here by this little arrow. He came in already gloved and gowned, which is really unheard of. Normally you glove and gown yourself with sterile materials once you enter a room, and he was presumably already in another room doing something while the staff was maintaining this case. So that is very suspect for sure. Now, I used to have a video camera in my operating room, a small little webcam, just so I could see what was going on when I wasn't in the room. It wasn't recording, it was just a live feed, so I knew when I was in my office, okay, they're prepping the patient now, or they're getting everything ready, the patient is asleep, it's time for me to head over there and be prepared. Or if the room was being turned over, I knew when it was finished. So it's just kind of for me to be aware of what's happening in my operating room. I also occasionally take videos using a head cam to record the procedure, as you've seen in some of my procedure videos. And I've also had staff members take video during the procedures to point out certain interesting things, or to show an unusual facet of a certain procedure, or something gross, or something weird, or something really cool. That's all very useful for documenting, as well as for sharing, for education, for social media, things that can help people learn about our field. Now it's a whole different story having a closed circuit television constantly recording, a camera constantly recording what's happening in the operating room for potential litigation. That's a tough one. It's sort of like, the first thing I thought of is the body cams that police officers have to wear. It's totally transformed law enforcement. Always having a camera and a microphone on you, recording what's happening, what you're saying, what you're doing. You know, it has created more accountability, but it's also really changed the way I know from personal interaction with some law officers, their comfort in actually upholding the law and pursuing suspects and doing their job. It's in some ways made it better for citizens, but it's also in some ways made it harder and even worse for actually enforcing the law. And in a similar way, I think we could think of cameras in the operating room. If I knew that there was always, Big Brother, so to speak, watching over my shoulder, would I do things differently? Not necessarily better, but would I do things differently out of concern for potential litigation? Would I take longer in the operating room, or would I do things just for show? It really is not the right state of mind to be in. When you're a surgeon and you're doing things ethically and expertly, and you're trying your best to be efficient and do a good job for that particular patient that is safe, etc., that's the mind frame you want to be in. And doing your job with experience and with concentration leads to good results. Doing your job without focusing on what you're actually doing as much, because you're focusing in the back of your mind on the appearances, that can be a problem. I think that certainly could be a problem. Or doing things you don't normally do just because you think they're expected to be done, even though it's not really the case, or it's not really better care. There's lots of potential problems with it. And then the other thing is, how much can a video really show? It can show a lot, for sure. And I think, I'm not speaking against it, I'm just throwing out the pros and cons. But I think a video can capture a lot of what's going on. But in this South Korean video that we talked about, where the patient died, ultimately, the mom had to watch the video hundreds and hundreds of times before she could pick up that there was a non-surgeon performing some of the surgery. Well, what does performing some of the surgery mean? Did they assist with a maneuver that looks like surgery? Of course, my scrub tech cuts my suture. Sometimes they will hammer using a mallet onto a chisel that I'm guiding in a rhinoplasty, for example. Is that performing surgery? And there are a lot of assistants who are trained and legally capable of closing or suturing, and that's certainly performing surgery within their scope. They are sewing, suturing a patient's skin on their own. That's surgery in a way. But what's important is that there is an experienced surgeon constantly there overseeing what's happening, and not only overseeing, actively involved and hands-on performing the operation, but with assistance. I think that's reasonable. That's the way most surgeons do it, with assistance. So there's a gray area is what I'm saying. There's a large gray area of what does performing surgery mean. If a video shows that there was an assistant who had their hand in the mix, and then later there was a complication, was it their fault? Now, the thing that is important, and what I believe the video in this case was really getting to the bottom of, is where there are unsupervised times when there was no physician in the room, or at least no surgeon at the table, and there were non-surgeons actually operating without supervision. That's problematic, unless, like I said, it's a PA or a nurse practitioner or someone who is accredited to perform, trained and accredited to perform their duties with the surgeon out of the room. So there's a lot of questions that come up with this, and we are for sure a very litigious society, and it looks like some other countries are as well. But unfortunately, with surgery, there are going to be complications. Whether or not you've done everything right, you could always find an infection or blood loss or a wound healing problem, or lots of issues that are a natural result of an imperfect science. Surgery deals with living organisms, which are not machines and cannot react predictably the way a computer can. And even computers, we know, have glitches and bugs. But human bodies are unpredictable, and we don't always get the result that we're hoping for. Of course, if things are done properly and with great care, the odds for complications do go down, but sometimes things happen no matter what, and it's nothing that you can control as a surgeon. And so that's important, and that's something I always tell my patients. Our complication rate, for example, with breast augmentation is about 1 to 2%, and that includes malposition, which is the largest complication. So it's not huge, and I do hundreds of breast augmentations every year. If we have 5 patients who have some sort of a complication, that's, in my opinion, a very low rate, yet that's 5 patients, and for those 5 patients, it's a high rate, and for them, it's important to have heard before surgery that there's a chance that something could happen, such as XYZ. So I'm really curious to see how this story catches on in other countries. Are we going to be seeing cameras in the operating room in the United States across the board, not just for cosmetic surgery, but like in South Korea for all operating rooms, general surgery, orthopedic surgery, ear, nose, and throat surgery? How will surgeons receive this? How will patients receive this? How will it affect their quality of care? We do know that most of the time when government gets involved with medical care, it often leads to worse care. Guidelines and restrictions that are meant to either protect the patient or to protect the system, the payer system in particular, can be pretty muddy and oftentimes not in the best interest of patient or provider. So let me know your thoughts. I'm really interested to see what you guys think about having a video camera constantly recording in the operating room. I know it gives me, as a patient, some sense of security, or if my loved one was having, for example, a spinal surgery, and I would have access to that full video to see what happened, how did they treat that loved one, what went on. I would be very curious to watch it, especially as a doctor, and to know what happened and feel some level of security that things are being done, on the up and up. But thinking of it more thoroughly as a physician and as just a person in general who has seen the detriment of such recording happening in other fields like law enforcement. And there's good from that, but there is lots of bad from it too. I'm not trying to make any judgments, but just throwing out the pluses and the minuses. I think it's a huge topic for debate, pretty interesting, and just wanted to throw that out there to you guys on my first video back from a long pause from Boobdoc, doing lots of other stuff, incredibly fun and exciting things, just not on YouTube. We're building a new facility, a brand new state-of-the-art surgery center for Zannis plastic surgery, as well as a new spa. All this stuff has taken up a lot of my time, but you're going to have an inside peek at all of that and our new surgery center once it's in use. So a lot more fun stuff to come up, and a lot more new and exciting things on the horizon here at Boobdoc. So thank you guys for watching and for being loyal subscribers. I hope you've enjoyed this video, and I can't wait to see you again soon. If you're interested in learning more about breast enhancement, please subscribe and hit that notification bell.